going to start. I hit record there now. All right. Okay, good evening, everyone. Thanks so much for joining us. This is the first SASMA webinar hosted by the KZN region. So thanks to everyone for joining us. My name's Neil, I'm from Maritzburg, and tonight we're really excited to have Curt Barnes presenting his master's thesis to us. It's gotten a great amount of a following already, so that's great news for the region. And yeah, so tonight's called Training Loads, Injury Profiles and Illness in Elite South African Rugby Players, which is the title of Curt's thesis. It was presented at SASMA last year, and it got some great feedback there. I personally watched it and it was awesome, so I reckon it would be cool for us to flesh it out a little bit in a webinar. So Curt's from Durban. Curt's got a BSc Honours in Physiotherapy and an MSc in Exercise and Sports Physio, and a special interest in sports physio. He's worked at Golden Arrows, Royal Eagles, Crusaders Rugby Club and Sharks, and he's currently working in private practice at the Sharks Medical Centre, treating a variety of sports-related injuries in elite athletes from athletics, rugby, football, surfing, obviously from Durban, and swimming. So just a couple of housekeeping rules. Please keep yourselves muted. Feel free to pop your questions in the chat box. I'm going to keep track of the questions, and then at the end we'll run through some questions for Curt. So pop them in the Q&A box. I'm going to be keeping my eye on that so that I can just get the questions through to Curt nicely at the end. The session is being recorded, so it will be available if anyone asks. Afterwards, I'm going to make the recording available. Just drop me a mail and I'll be able to send that recording over to you. Yeah, so thanks so much for joining us. Here we go with Curt.
Good evening, everyone, and thanks, Neil, for the invitation. And it is indeed a great pleasure to be able to present my study on a platform such as SASMA, so I'm very thankful for the opportunity. So without any further ado, as Neil mentioned, the title of the study is Training Loads, Injury Profiles and Illness in Elite South African Rugby Players. So in terms of injury and rugby union, specifically the Super Rugby tournament, what we do know is that we have over the past used time loss injury as the main sort of injury definition to go to, and this is following the 2007 consensus statement on injury definitions and methodologies. So we know that injury incidence in rugby union is comparable to other collision sports, and we also know that a high level of play has been associated with a higher incidence of injury. The injury incidence within Super Rugby tournament studies have also shown to be higher in comparison to general rugby union, and the evolving and demanding nature of the Super Rugby tournament has been associated with an increased risk to both injury and illness. Also to note that match-related injuries in the Super Rugby tournament are substantially higher than training injuries. So when looking at injuries within the Super Rugby tournament, we look at the injured player proportion. So this is pretty much the percentage of players that have been injured in a tournament. And the reason for using this model or this percentage is because various studies in the past have sort of taken longer durations or shorter durations. So it's a good way just to estimate the percentage. The downside of this is that each injury counts as a new injury. So recurrent injuries won't be shown as recurrent injuries, but instead an overestimation of new injuries. This being said, with using the injured player proportion, they still found that the Super Rugby tournament injury percentage rates are still twice as high than 3 Rugby World Cups. And so in general, the range within Super Rugby tournament is between 54.6 to 82%. When looking at the anatomical site, the lower limb seems to be the most frequently injured body part. And in terms of injury type, muscle or tendon and joint or ligament are more common than other types. Being tackled and tackling are the most frequent causes of injury, and the most common time loss severity of injuries is reported as minimal, which is 2 to 3 days of time loss. So looking at this timeline, this is post 2007 consensus statement where all the definitions and methodologies were then standardized. And as you can see, there is not too much data or studies that have been done to be able to contribute to the epidemiological data of injury within Super Rugby tournament. The last one, I must say, has been a fantastic study, and this was done by Martin Schwellnus and colleagues, and this looked at 6 teams with 482 players over a 5-year period, and they had 93,641 player hours of exposure recorded. When looking at illness, you'll find that there's only been one illness within the Super Rugby tournament, and that was within 2010. So when looking at the illness trends in Super Rugby, we have used the definition as any non-trauma related symptom or sign presenting in a player that requires a medical attention from a team physician on that specific day. When looking at illness incidents, the high incidence of illness has been noted in the Super Rugby tournament, and to give an example, it's 72% of the squad over a 16-week period were affected by illness. And this is much higher than other sporting codes that used similar methodologies. And this ranged from the Winter Olympics to football. When looking at the bodily system affected, we found that within the Super Rugby study performed that the respiratory system seems to be the most commonly injured system, and the diagnosis is upper respiratory tract infection being the most common diagnosis. Fortunately enough, the severity of the illnesses that are recorded within the Super Rugby tournament have not resulted in extensive time loss. For example, 83.3% of the illness that was recorded resulted in no time loss. The main consideration of illness is the decrease in performance. And this has been observed in acute illness, that acute illness can last for 2 to 4 days post-clinical recovery. Unfortunately, this has not been examined yet within the Super Rugby tournament, but hopefully will be soon. When looking at the decrease in performance, it does raise a few red flags given our current circumstance in terms of the pandemic and how that will affect elite sportsmen. When looking at prolonged competition load and insufficient rest periods, such as in the Super Rugby tournament, an S-shaped curve is important to keep in mind. What an S-shaped curve means is that it is suggested for the elite athlete population where there's actually a decrease in illness risk at absolute high training loads. The J-shaped curve represents recreational sub-elite athletes, and as you can see in the graph, an increase in training load or absolute training load results in an increase in injury risk. When looking at training loads, we look at an athlete's preparedness and the injury risk that can be determined. And this has now been noted to be determined as an acute to chronic training load by emphasizing the positive, which is the fitness aspect, or the negative function, which is the fatigue. Typically, training loads are altered during different cycles of the season. And the ideal is to try and reach optimal training load. Optimal training load alludes to an enhancement of performance whilst limiting the negative consequences of training. For those working in the sports medicine environment, you'd note that injuries that are related to load are viewed as preventable, and that's because training load is considered a modifiable risk factor. Inappropriately managed training loads can increase the risk of injury through various mechanisms at a tissue level as well as a whole athlete level. What's important to note, and what's a very important take-home message, is that it's not only high loads that can result in an increased risk to injuries, but also low absolute loads. The mechanism for that is that there is not sufficient adaptation or durability of an athlete to be able to adapt to the given loads past that low absolute threshold. And so the risk of injury is therefore high. There's also been a substantial amount of research that looks into the effect of sudden or acute changes in load and increased risk to injury. When looking at training loads, and particularly in the study, we look at internal and external training loads to be able to determine a training outcome. Internal loads looks at the subjective and external looks at the objective. Internal training loads looks at an athlete's perceptual or physiological response. An example of this would be your sessions rating of perceived exertion, where players would report that rating within 30 minutes following a training session or match. External training loads is the physical work that has been completed. And for a team-based environment, this would be using a GPS, right, in terms of measuring distance. So there are many measures that are available, but there is limited evidence for their use. The individual characteristics of an athlete in combination with the internal and external training loads provides the outcome, and more so the response of training. The magnitude of training load can vary between individual athletes, and this is very essential when looking at the response of training load, especially within a team environment. The individual response and the alignment to monitoring sport-specific thresholds is important in order to determine how to manipulate the training load. A measure for an athlete's preparedness and the injury risk, as mentioned earlier, is looking at a ratio by comparing the acute training load to the chronic training load. So acute training load refers to 1 week of training. Chronic training load refers to 3 to 6 weeks on a rolling average. What they have now established is that there's a protective effect from high chronic loads, as opposed to, as I mentioned earlier, the acute loads that can result into an increase in injury, or sudden increases in load can result in injury. So this being said, when you determine the ratio, you have high chronic load but a low acute load. This can represent the fitness or the positive function. Vice versa, if you have high acute training load and a very low chronic load, this can result in the negative function, which is known as fatigue. If we look at the graph presented, what they had found in the respective study was that between 0.8 and 1.3 seemed to be the sweet spot where there was a reduced injury risk. Moving into acute to chronic ratio of more than 1.5 was considered the dangerous zone, where there was a substantially higher increase to sustain an injury. They've also found that a 5 to 10% progression more than the previous week's load seems to be the optimal adjustment, but more than 15% of the previous week is a 21 to 49% increase in that risk. And so looking at injury prediction, we pretty much want to be able to look at the current load that an athlete is experiencing and manage that or compare that to the planned load in order to determine the risk. The model that was established by Gabbett, which was in 2010, reports a specificity of 98%, sensitivity of 87%, and a positive predictive value of 62%, and therefore provides a platform for managing training load and injury risk. As mentioned earlier, the training ideal was 0.8 to 1.3, and above 1.5 was considered the danger zone. What's important in this slide to note is that different sports vary in their training load relationships, and thus the ideal or optimal range can vary across sports and across populations. And so because this model has become well established, this was the injury prediction method that is a sort of go-to environments. This is still, however, an uphill climb in terms of looking at the training load and injury model. Further research is needed to report the effectiveness of this hypothesis in rugby union. And going forward, there's been articles published on mediators and moderators of the acute to chronic training load, exponentially weighted moving averages, and mathematical coupling and discretization. And these are studies and comments around the acute to chronic ratio and potentially a way to move forward in terms of the model. So the objectives of the study was to determine the incidence of training and match injuries, as well as to determine the incidence of illness. We looked to determine the anatomical site, type, mechanism, and time loss of injuries. And when I say time loss, it's also severity. To determine the potential associations between the internal and external training loads, injuries, and illness respectively. And this was all in the 2017 Super Rugby tournament. So the significance of this is that in injury prevention, we need to understand the magnitude, the nature, and the context within which these injuries occur, as well as the illness. And so this study looked to contribute to the limited epidemiological data on injury and illness incidents during a complete Super Rugby tournament within a South African population and context. We also wanted to determine the relationship between how a modifiable risk factor like training load coexists with injury and illness over a complete season. In looking at the methodology, this study was a descriptive observational surveillance study design, where we recruited 45 adult participants over a 28-week period. The season was divided into 3 main phases, and team selection was based on ongoing consistent recordings of training load, injury, and illness data. The study was also guided by the 2007 Consensus Statement on Injury Definitions and Methodologies. From the 45 participants recruited, once the inclusion-exclusion criteria were applied, 39 participants were then eligible to participate. In looking at the results, a total of 6,277 player hours of exposure was recorded, and an overall incidence of 12.8 per thousand player hours. The majority of the injuries occurred during the early competition phase, and this was 48.8%. Match injuries accounted for 75% of all time loss injuries, and a large proportion of match injuries, being 40%, were of a moderate severity, which is 8 to 28 days of time loss. The proportion of players that sustained a time loss injury, and this is looking at the injured player proportion, was 76.9%, which means that 76.9% of the squad had sustained an injury, or a time loss injury rather. The proportion of players that sustained a time loss injury was severe enough to prevent 8 days or more of participation in training or matches, and this was 25.6%. In all, match injuries were 73 times higher than the training injuries. According to the anatomical site, the lower limbs sustained the greatest proportion of injuries of 62.5%, and specifically the thigh followed by the knee. In terms of severity, a moderate severity was the most frequent severity. In terms of mechanism, the category known as other was considered to be 32.5%, followed by the tackle, which accounted for 28.8%. Contact-related injuries were greater than non-contact-related injuries, and 96% of the injuries were considered as soft tissue injuries. Muscle or tendon injuries accounted for 64.9% of all injuries. When looking at illness, the illness incidence was 1.8 per thousand player days, and the most affected bodily system was the respiratory system, with diagnosis of upper respiratory tract infection. Fortunately enough, the time loss was very low from the illness that was acquired, and the proportion of players that acquired an illness was 28.2%. When looking at training loads, the median value of internal training loads in the injured group was higher than the non-injured group. A significant negative correlation between the decrease in internal training loads and the increase in the incidence of injury per season phase was noted. Preseason had the highest median value of both internal and external training load, and no significant correlations between external training load and injury incidents were noted. What was interesting was that as internal training load decreased, injury incidents increased. Internal and external acute to chronic ratios showed a linear and positive increase over time, and per season phase from preseason to late competition, 0.8 to 1.1 was the range for internal acute to chronic ratio, and 0.9 to 1 was the ratio or the range of ratio for the external acute to chronic ratio. No significant correlations between the internal and external acute to chronic ratio scores and injury and illness were noted, and no significant odds ratios were demonstrated between internal and external acute to chronic ratios and injury and illness risk for these categories. We did find that weekly differences between internal and external training load were similar, but there were evident periods of mismatch between weeks 6 and 9, between internal and external training load, and between weeks 10 and 12. To discuss more, The age of the population was 25.3, which is similar to previously reported squads in the 2008, 2012, and 2014 Super Rugby tournaments. This study was a longer duration in terms of a complete season compared to previous studies, but the exposure was less than the study published by Martin, Trollness, and colleagues in 2019. There was an increase in the overall incidence of injuries compared to the previously reported 5 Super Rugby tournaments from 2012 to 2014, which were 10 per 1,000 player hours. The precise reason behind this is unclear, but could be related to various factors such as training methods, techniques, schedules, traveling, and the list goes on. An increase in the incidence of match injuries with 241 per 1,000 player hours was higher than previously reported in the Super Rugby tournament, as well as in general professional rugby union. The proportion of players that sustained a time loss injury was also higher than the 1999 and 2012 Super Rugby studies, but it was lower than the 2008 Super Rugby studies with 82%. 25.6% of the players that sustained an injury severe enough to prevent training or participation in matches for 8 days or more was less than previously reported. And even though the variance was very little, injuries to the lower limb was slightly lower than previous studies, and injuries to muscle or tendon was slightly higher than previous studies. Not surprisingly, the tackle event was responsible for a large majority of the injuries, and as mentioned earlier, a moderate severity accounted for the majority of match injuries. The precise reason behind why the severity of these injuries, of these match injuries, were so high also remains unclear. The overall incidence of illness was much lower than reported in the 2010 Super Rugby study, with 0.8 per 1,000 player days, and the proportion of players that acquired an illness was also lower. Time loss injury from illness was also much lower than reported in the 2010 study, and the reasons behind these also again remains unclear, but can be attributed to the fact that the 2010 study was for a 16-week period and ranged up to about 736 players, whereas this study included 39 players for 28 weeks. Factors that also come into play is a union's individual illness prevention strategies, such as probiotics, hygiene, nutrition, and so on. But fortunately enough, the time loss away from illness was not high, and this can be attributed to the medical support as well as early diagnosis, especially over that 7-year period between 2010 and 2017. When looking at the internal training loads, the values of the internal training loads per season phase were higher than previous studies in rugby union, and internal training loads were highest in the preseason, which seems to be a common trend across other studies. The high internal training loads in the preseason phase potentially led to the increased rates in the early competition phase. And what was interesting was that a reduction in the internal training load resulted in an increase in injury incidence. The higher internal training loads, which were higher in the injured group compared to the non-injured group, probably alludes to the fact that the injured group did a lot of off-field conditioning. So those players were working very hard, most likely. With regards to the weekly mismatches between weeks 6 and 9 and 10 and 12, between internal and external training load, what we found was that as the external training load increased, the internal training load decreased. The reason for this could be attributed to a few reasons. One of the reasons is that players could have been developing physical fitness. So as they were running more, they were able to tolerate those loads, and their RPEs for the specific session weren't as high as previously reported. Another reason for it could be the entering into season, especially when moving from week 7 into week 8. Sorry, I just think. Okay, sorry about that. So the second reason for this could be that the players were entering into season, especially between the weeks 6 and 9, which could result in an increase in the external and a sort of decrease in the internal load. And lastly, I think a potential reason for this was that there was an alternative training regime. For example, the players could have been doing a lot of strategic training where they walk through different moves, but the duration of the session is longer, but the intensity is lower. Therefore, the RPE is lower, but the time on feet in terms of the GPS recordings would still be higher. When looking at the internal and external acute to chronic ratio and injury, this really highlighted the importance of using internal and external loads when measuring and determining the training outcome. And the above example of the mismatches between internal and external gives further insight into the changes that occur within the squad, and then can help those working in those type of environments to further investigate the reasons for that. So even though the squad that was under study was within the suggested sweet spot of 0.8 to 1.3, there was still a high incidence of injury. And this alludes to the important fact that interpretation must proceed with caution, and that different sports and different populations vary in their own training injury relationships. And this highlights the importance of developing your own training and injury relationships within the specific working environment. So looking at the limitations of the study, the sample size was small, but comparable to previous studies, and 86.7% of the squad's data was used. Anthropometric data was omitted from the study because the cohort was highly identifiable, and routinely collected data can be seen as a limitation, especially when categories such as other under injury mechanisms become predominant. When looking ahead, we want to try and encourage research to stem towards complete seasons of longer durations, accounting training loads, injuries, and illness, targeted risk management strategies, further investigation into the risk factors and mechanisms of injuries. And I know this has been done through all the research that's been done in tackle mechanics and its influence on injury. And we sort of want to mitigate the category, as mentioned earlier, of other, because if other takes up a large majority of your mechanism, that influences our ability to understand what mechanisms truly are influencing the rate of injury. And I think further investigations in terms of linear mixed models and the exponential weighted moving averages should be further investigated when looking at an injury prediction model. So to conclude, the incidence of match injuries in the study was higher than previously reported in the Super Rugby tournament. The profile of match and training injuries, anatomical location, type, mechanism, and severity were similar, but the match and training injuries with 73 times higher rate from match to training was substantially higher. Illness rates were significantly lower than previous studies, and this study highlights the importance of internal and external training load measures being used in combination to determine training outcome. Further studies are required to determine the relationship of training loads and injury profiles over consecutive seasons and in multiple teams. Thank you very much.
Awesome. Thanks so much, Curt. That was really, really cool. After having seen the study at Congress last year, it's awesome to have seen it a little bit more fleshed out here. So guys, there's no questions that came through on the chat box. So if you've got any questions, let me give it a minute. Unmute yourself and shoot fire with a question. I think it's a good sign, Curt. You think you dealt with everything really well. So I'm going to just kick off with one here quickly. So you said your injury incidences were significantly higher than the previous Super Rugby studies. Why do you think that is?
Well, it's a good question, Neil. To be very honest, the precise reason is unclear. And the main reason is that there are so many varying factors that could influence the increased incidence. But it could also be associated with the trends that they're seeing in terms of level of play. So they're finding that the higher level of play is resulting in a higher incidence of injury, especially when they now start considering the speed of the game as well as the number of contacts that are made in the game, especially with the rucks per game. So I definitely think level of play has a huge role to influence, but the precise reasons are unclear.
Cool. Okay, so here's one from Nick. Any tips for using acute chronic workload ratio for return to play for physios and bios?
Well, funny enough, I mean, that is probably one of the most interesting, how do I say, or the most needed in terms of what we do as physiotherapists and healthcare practitioners. Tips would be that you want to lean on your high chronic load when introducing your player back into the return to play cycle. You do want to try and avoid your sudden or acute week-to-week changes, and you sort of want to keep that ratio. You sort of want to identify what that training relationship is for that specific player, because you're no longer only working with individuals and team-based sort of experiences. You're dealing with someone, let's use, for example, with an ACL. So monitoring their training load in the recovery between each week, you almost need to model a training load relationship within specific weeks over time, and then see where you can play around with that ideal range to make sure they're optimally training hard, but at the same time not increasing the amount of pressure on the existing injury. So I would definitely say, to be safe, stick to the evidence-based with high chronic load, and try and avoid those acute spouts of training load.
Awesome. So from Ken here, so did you, if anything, did you find an association between injury and travel? Obviously the Super Rugby tournament involving a lot of travel.
So not in this study specifically. I know there has been a previous study that has looked at the influences of travel, but because we didn't align specific factors related to time zone factors as they did in the previous study, we didn't look into anything related to travel. Yeah. Cool. But it definitely could be an area of focus, and that's why the Super Rugby tournament, I guess, is the ideal platform. It's because it has so many different elements to it as it's evolving each year. Cool.
So here's one from Kaylee. You found that higher acute chronic workload ratio increases the risk. Would you find this ratio higher in the early season rather than later season due to the improved adaptation for load? That's a great question.
Sorry, just repeat that last one, Neil.
Okay, so you found that the higher acute chronic workload ratio increases the risk. Would you find this ratio higher in the early season rather than later season due to the improved adaptation for load?
Okay, so specifically within this study, remember the range was between 0.8 and 1.1. So looking at previous research, we were still within the sweet spot value according to previous ranges. So they actually, we couldn't really determine that there was a specific range that had an increased risk, which was the interesting part, because as the internal load actually decreased, the injuries lifted up. So for this specific cohort, I do feel like adaptation had a big role to play. But I also see that when they were at their highest values of 1.1, this was towards a late competition, their injury rates were actually lower. And so I do think that the model or the ratio for this squad in terms of injury risk was actually at the lower value. So I think the lower the values were for this squad, the increased risk of injury. I think that just with this population, there seemed to be a lower risk in the later competition where we would expect a high risk to exist.
Yeah. So just for everyone here, just bear with us. If we do get cut out here, just do bear with us. We are racing against time here. So, but I think it's really cool, these questions that we're going through here. So we're just going to keep going. But if we do get cut, please bear with us. So there's none more here in the chat box, but just here quickly from my side, I mean, if we look at great studies like these coming out and on the Van Mechelen model, you know, the next step is implementing some kind of injury prevention strategies, and you didn't mention it in your discussion. So, I mean, you alluded to you alluded to one or two injury prevention strategies, but what other inferences can you make for sort of injury prevention from this?
So based on this study, a big part is actually within the tackle research. I feel that a lot of attention needs to be placed on the tackle and the influences of the tackle on injury. Because if we look at the severity being 8 to 28 days and 40% of injuries just related to matches within the early competition phase, that immediately shows that there's something that's going on in terms of the match demands, especially looking at the tackle as well, that increases that risk. So I do think a big focus on tackle research would help a lot to mitigate the risk of injury. And then in terms of other prevention measures, other than load being your modifiable risk factors, I do think that, especially within a South African context, we do underplay the basics in terms of the nutrition, in terms of the sleep, in terms of the recovery, and looking at the athlete as a whole. Within the Super Rugby context, I do feel that some sort of rotational player system does have a role to play or does have a place, because most times coaches would use the strongest teams week in, week out, and the amount of loads those players end up going through is actually quite substantial. And when there is an injury at that level, the backup player that then substitutes in more than likely hasn't actually reached the loads, even if they have conditioned and tried to maintain their sort of ratios. You'll find that coming off the bench for 10 minutes every week is still not sufficient to then sort of move through a full game, 80 minutes of full contact rugby at that intensity. So I do feel that the rotational play system also has a role to play in the prevention. And I think another important aspect is, besides looking at the neuromuscular fatigue aspect, is also, as they have done overseas with the FIFA prevention programs, is looking within rugby to actually integrate a bit more specific joint-based injury prevention strategies in terms of rehab and injuries that included into their movement prep. I do know that screening has a role to play with injury risk, and so that individual screening and individual interventions does have a big role to play in the bigger picture.
Yeah, definitely. Here's one from Hayden. How involved have you been with the load management in the recent teams you've worked with? So obviously just in the context of physio, how involved have you been with load management specifically?
So within the context that I was working in, I was very involved, and I was involved in a method of, I wanted to understand where the squad was at. So it wasn't really a position of the physios now sort of like creeping on the strength and conditioners, but it was more as a team, let's understand what's going on with the squad together. And as someone that's focusing on the injury perspective, how is the loads influencing the sort of varying injuries that we're seeing? And so I was very involved when soft tissue injuries would be sort of predominate, and look into exactly what's going on in the squad that could be elevating that risk. So I think it's really important to really nurture that relationship with your strength and conditioners and your coaches to be able to be as involved as you can be in terms of advising, especially when you start spotting certain trends starting to kick in with regards to injuries.
Yeah. So here's a nice relevant one from Ken. I think Ken, you might be feeling as bummed as I'm feeling about World Rugby wanting to mitigate our bomb squad. But so World Rugby are talking about reducing the number of substitutes in a game from 8 to 6, i.e. increasing the fatigue of players. What do you think about this in terms of the load of the players?
Well, look, I think there's no doubt it's going to increase their load substantially. And I do think that the sort of after effects will only really be felt once it's implemented, if that makes any sense. But I do think essentially, and recovery is probably going to be taken a bit more seriously than what it is at the moment, in terms of looking at every possible way to aid recovery. And I do think that players would really struggle to keep up if there's similar tournaments to the Super Rugby format, especially when travel over more than 5 time zones is then applicable.
Mm. So here's another one from Nick. How much should we trust the prediction of acute chronic workload ratio in injury in terms of making changes to our teams or athletes in the light of injuries being multifactorial? Is the statistic modeling very strongly associated?
That was a brilliant question. So the important thing to remember is that when looking at this injury prediction model, most of the studies that were done were in rugby league and were also, for example, the example of the more than 15% increase from the previous week, it was based on cricket. So the ideal ranges that were presented in those studies shouldn't be used as a benchmark for comparison. I do think it's more important to develop your own ratios for your particular squad. Once you can establish those, I think you can then understand the context. And once you understand the context of your squad, you can then become a bit more involved in terms of making meaningful interpretations. So when the critique also comes along the injury prediction models of estimated exponential weighted moving averages and discretization, you start actually really noticing that this model is really good and the objective methods of what we can use and what's available for us to use in terms of developing an acute to chronic ratio is useful, but there's a lot more to consider when looking at mathematical coupling and the fatigue effects over time and the decaying effects that should actually come into play when calculating chronic load as part of your ratio. So I do think that we should use what we have at our disposal to the best of our ability based on the evidence, but I do think we also need to keep an open mind to where we're going.
Here's another one from Kaylee. Do you think that the cause of higher incidence of injury in match day against training is due to the lack of control in tackling, being slightly more reactive than controlled in training?
I do think it does. I do think it plays a huge role. I think for years, the biggest struggle has been to make training at the intensity or replicate game scenarios through training. I think that's a huge challenge at the moment. And sometimes what you'll find is that you then tend to overcook teams in trying to replicate that sort of model. The type of demands on a match day are much different to anything that you can reproduce in a training format. So I do think it has a huge effect to play. I do think that neuromuscular fatigue in terms of tackle technique is also a big, big role. And when we were talking earlier about the new substitution rule that could be implemented, that's a massive factor, because if players are on the field under excessive amounts of fatigue, their tackle technique is most likely going to be reduced, and their coordination speed of decision-making, speed of their muscular activation will be substantially affected.
Yeah. Cool. So there's no more questions coming through on the chat box. So I think what we'll do is please drop me or Curt an email. I know Curt's email address is down there at the bottom of the screen. You're welcome to email me as well if you've got any more questions that I can relay to Curt. Curt, thanks so much for presenting to us tonight. It's been massively informative. It's been really cool to see this study fleshed out a little bit more. And yeah, really good luck going forward with this study as well. And we hope to see you presenting it a few more times to even bigger audiences. Thanks so much, everyone, for joining us. We're going to, as SASMA and KZN, try and get a few more talks coming through to you guys. Please keep your eyes on the SASMA email and everyone's social media. So yeah, thanks so much for joining us, and have a great evening. Tomorrow's Friday, so that's at least the hill is over. And yeah, have a great evening. And please remember to drop us an email if you've got any more questions. I'll relay that to Curt and get the answers back to you. Thanks so much, guys.
Thanks, Neil. Thanks, everybody, for joining.